Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we look at the difference between the important, that is the Caput, succedaneum, as well as the cephalohematoma. So firstly, let's compare the CS. The Caput succedaneum, it's located in the presenting part of the head. So it is present in the presenting part of the head. Next, when does it appear? It appears immediately after birth. So it occurs after birth. Next is, what is the cause of the Caput succedaneum? The cause is there is a prolonged labor. So this is caused due to a prolonged labor causing various stasis and edema. So there is prolonged labor, and it causes the venous stasis and edema. Venous stasis, as well as it can lead to the edema. So how does the Caput succedaneum extend? So when you look at the extent of the Caput succedaneum, it is both hemispheres, that is, it crosses the suture line. So CS, it crosses the suture line. CS, it crosses suture line. And the period of absorption being 2 to 4 days. And when you look at the treatment, there is no treatment for the Caput succedaneum. Next, we move on to the cephalohematoma. So this is the cephalohematoma. So cephalohematoma, it is the periosteum of the skull and the bone. The presenting part being the periosteum. Of the skull bone and also the bone. So how does the time of appearance? So when you look at the time of appearance, TOI, it is several hours after the birth, whereas Caput succedaneum was immediately after birth. This occurs several hours after the birth. Now, what will be the cause of the cephalohematoma? Cause of the cephalohematoma is there is instrumental delivery. Instrumental delivery, and it can also be due to the cause of rupture of the emissary veins. So there is the emissary veins. So emissary veins can rupture. Now, how is the extent of the movement? So in case of the extent, there is the individual bones, they do not cross the suture line. So cephalohematoma does not cross the suture lines. Now we move on to the period of absorption. So what will be the period of absorption? Whereas a cephalohematoma, it took about 2 to 4 days. Now when you're looking at the cephalohematoma, this is going to be 2 to 3 months. That is 2 weeks to up to 3 months for the period of the absorption. Now, how do you treat this? The treatment is going to be mainly supportive. It will be supportive, and it can cause the neonatal jaundice. It can cause the neonatal jaundice.